is there a way that we could try to help outside of the patient explaining? Is there a better way that we could help these people who are assisting with the follow-ups remotely to maybe get them on board even and get them some kind of training?
Yeah, we had this discussion today as part of our sort of case panel where we had cases presented,
Hmm.
and I was moderating the session and presenting some cases. And one of the concerns was, well, the nodule may not completely go away, and so that nodule is present. And when you look in the ultrasound, it may look irregular. And what is this nodule doing now? And if you don't have any familiarity with RFA, then you go, oh my God, that looks terrible. Let's biopsy.
Hmm.
And then what does the biopsy show? Does it show something atypical? And now you're like chasing your tail, and all of a
Hmm.
sudden you're ending up in a surgeon's office for surgery. You're like, wait, how did it ever get to this?
Hmm.
So I do think what's important is when you can't follow up directly with the provider who performed the RFA and somebody else is going to be doing the ultrasound, it's incumbent upon that provider to really talk with the ultrasonographer or the radiology team or the endocrinologist, whoever's doing it,
Hmm.
to say, look, we did RFA, and this is what we expect to see. And we expect the nodule to look like this. And I can give you some characteristic images. And I wouldn't do anything at 6 months, 12 months, 18 months, unless you saw that this nodule was growing in size, bigger than the original nodule, and it had changes that would make you think about malignancy. But as it is now, you wouldn't want to do anything about it. This is something of an evolving process, and you may see something even different the next time you evaluate the patient. So we know that these patients, you guys who've had it done, have had fine needle aspiration biopsies that have been proven to be benign, and we're very confident about that. And I think these changes that we're starting to see on the ultrasound, we're getting more comfortable with, but it's our job to educate those who haven't done it to say, hold off on jumping in and going, oh, I got to stick a needle in this thing. It looks really unusual now. And it didn't go away completely. Isn't that what the treatment's supposed to do? It's changing the mindset. And that's important. I think it's really our responsibility, the treating physicians, the ones performing the RFA, to do that. I know you guys are trying hard too, and I'm certainly sure that you would be like, hey, wait a minute, don't biopsy this thing. Call my doctor who did the RFA first.
Right.
That's good. That's all you have to say, but it's on us to really explain the rest,